Good afternoon, welcome. Achieving scientific equity includes the steps to analyze existing data and inform practice. Without scientific equity, obtaining health equity is unlikely. My name is Qing Li, an OB/GYN trained injury epidemiologist and adjunct clinician scientist from University of Mississippi Medical Center. In a transdisciplinary team science approach, co-authors and I design steps and respond to the trans-NIH implementing a maternal health and pregnancy outcome vision for everyone improve initiative. The title of our presentation, Preventing Perinatal Depression, Substance Use, and Self-harm Ideation to Design Injury-Related Maternal Early Warning Systems and reduce maternal morbidity and mortality. Homicide, suicide, and drug overdoses are leading and preventable causes of pregnancy-associated deaths in the United States. However, there are risk factors such as maternal depression, substance use, and self-harm ideation haven't been evaluated in maternal early warning systems for screening and prevention. Relationship education is an evidence-based preventive intervention to address marital distress and partner violence. Our objective is to evaluate the effectiveness of nurse home visiting program, augmented with comprehensive relationship education on preventing those three factors. We performed secondary analysis of longitudinal randomized control trial with data collection from 2007 to 2010. In the Nurse Family Partnership NFP program in Oregon, 238 first-time low-income pregnant women were randomized to a standard or augmented program, when nurses delivered the Within My Reach comprehensive relationship education curriculum. At pregnancy and 1 year and 2 year follow-up, research assistants interviewed mothers using the Edinburgh Postpartum Depression Scale, including an self-harm ideation item, alcohol use disorder identification test, and a drug abuse screening test. Multi-level zero inflated negative binomial regression models and the proportional odds model of generalized estimation equation were performed, adjusting for maternal age, race, ethnicity, education level, and nativity status. Table 1 shows maternal characteristics at baseline and those three risk factors over 3 weeks. The augmented program didn't reduce any of the 3 targeted risk factors over the 2 year follow-up. The weave and the intervention interaction terms were not significant and had a limited power, for example, less than 10% in power analysis. In conclusion, the Nurse Family Partnership Program, augmented with relationship education, didn't affect maternal depression, substance use, or self-harm ideation. Our study findings inform effort to build a consortium, engage further, enhance co-parenting, identify setting, and design and implement a hybrid effectiveness implementation pilot trial of injury-related maternal early warning system to prevent those risk factors collectively. Our study responds to NIMHRA to address mental health disparities through aggregating and mining data set and promote scientific equity in reducing maternal morbidity and mortality. Here is a list of select reference. Any question, comments, and suggestions? Thank you.